slideshow, just kind of discussing as a little information or whatnot on working as a respiratory therapist and kind of discussing what a respiratory therapist does. I've been a respiratory therapist for 4 years now. I currently have my bachelor's in respiratory therapy, and I work at a Trauma One hospital. Very busy, a lot of patients um, in the ICU with anywhere upwards from 6 to 8 ventilators, um, 20 bed NICU, about a 10 bed PICU, um, 24 bed ICU, and a pretty big ER. So, pretty busy. Um, about 6 floors. So you have anywhere from your oncology floor, your cardio floor, your surgical floor, your neuro floor, and obs floor as well. So this is just kind of an information segment for people inquiring about becoming a respiratory therapist, what it entails, some of the pay, um, the testing that's required, and then my overall thoughts on it. So we'll begin. So what do RTs do? RTs pretty much are the forefront for airway management. And what does that mean? It means making sure that the patient can breathe. Essentially, that's our job, right? So whether that's a patient who's on, you know, a COPD patient who needs a breathing treatment, or a patient who's not breathing right and needs to be intubated, and we have to breathe for them through the ventilator. Um, we also deal with ventilator management, whether that's CPAP devices, bilevel, or invasive ventilation, where a patient's connected with the breathing tube or tracheostomy. Additionally, chronic pulmonary disease care, so that's your asthmatics, that's your COPD patients, that's your cystic fibrosis patients, any patients that are chronically ill, um, whether they're trached or they have some other pulmonary disease like pulmonary hypertension or interstitial lung disease. We'll be treating pretty much all of them to help them breathe a little better and optimize their oxygenation levels. And some additional things we may be involved in are the sleep lab, which we have to be there at nighttime and get patients tested for sleep apnea to see if they need a CPAP device or a BiPAP device. We may be sitting pump on the ECMO team. Um, we may be setting up arterial lines in the ICU. And we may be doing flight calls. So some respiratory therapists will do 48-hour on-call flight call where they pretty much transfer patients to and from a facility and manage their airway during that time. Generally, we're seeing this more common flight calls with pediatrics, because paramedics, there's that discrepancy between paramedic care and respiratory care as far as airway management goes. So um, in the state that I'm in, a lot of respiratory therapists do more of the pediatric flights. How long does it take to become a respiratory therapist? So I broke this down into year 1 and year 2 with 2 different sets. So once you've accomplished your prerequisites, which we'll go in over next, it's about a 2-year program, depending on the program you're at. So I went to a private college. Mine was about 18 months. If you're not, it's about 2 years with summers off. So kind of discussing classwork first. You have your basic respiratory anatomy and physiology. You have ABG interpretations that you're learning. You're learning basic lab values like your sodiums, your calciums, your blood glucose, uh, your hemoglobins, your white blood count. You're also learning about basic respiratory illnesses, mainly in adults. So like your COPD patients, your CBABE patients, your asthmatics. Uh, you know, very, very basic and kind of generalized stuff in the first year for classwork. Nothing too in depth until you get to year 2. Also in year 1, you'll be doing labs and clinicals. Labs, you'll be practicing your skills. I think the first class I took was like hand hygiene class, but so I didn't include that. But you'll be learning ABG draws, how to set up for intubations, maybe even do one on a mannequin, nebulizer setup, proper ventilation technique for bag valve masks, and then you'll be setting up, but not necessarily turning on the ventilator. Generally, they'll have you set up like a BiPAP or a CPAP, and then an invasive ventilator as well. It's just kind of program dependent. For clinicals, you'll be doing more floor care, and you'll be doing some ICU/ER, which you'll learn kind of the hands-on skills there as well. In ICU, you'll probably be suctioning patients. You'll be probably doing oral care, ABG draws, arterial line draws, nebulizer treatments even. Um, just kind of depends on who your preceptor is going to be. Sometimes they're a little bit, standoffish. Sometimes they'll let you be all hands-on right away. It just kind of depends on the person. Year 2, you have more classwork, obviously. You'll be learning more about ventilators, some of the settings such as volume control plus, pressure control, SIMV, pressure support, PRVC, um, a lot of ventilator modes, kind of hitting you at once. So kind of learning what they do and who they're for is kind of the most important thing. Waveforms as well. You're kind of be looking at that football waveform. Um, You'll also be learning a little bit about pediatric pulmonary physiology. I say a little bit because it's touched on, but you know, you really have to be involved in it to really get it all because it's a bunch of information coming at you at once. So, focus on it, but don't fret if you don't understand. Ask the teacher; they'll be the ones helping you out. You'll also be learning about peds chronic illnesses such as cystic fibrosis or CF, bronchiolitis, croup, and then some patients with the neonates. You'll be learning about tetralogy of Fallot and how some of the patients need our assistance with ventilation coming out of the womb. You'll be learning a lot of TMC questions. You'll be practicing those kind of day and night if you like to study, or just kind of be taking those TMC tests like till they numb you, basically. Additionally, you'll be touching on a little bit of PFTs, kind of your total lung capacity, vital capacity, uh, all the lung volumes that are required for PFT measurements to determine if a patient who's had a proper PFT is restrictive or obstructive. And then you'll be doing Kettering, and Kettering is kind of the culmination of getting you prepped for the TMC and the CSE, which we'll be discussing later. For year 2 labs, year 2 labs is a bit more hands-on on the ventilator. You'll be getting a lot of ICU experience, and then depending on the facility, they may send you on in the NICU and PEDS. Just kind of depends on where you're going to be doing your clinicals at. And then sleep labs are definitely an option. Not every program offers it. I never did sleep lab, so just kind of depends on which program, which facility. In the lab, you'll have to take your NRP class, which should be provided by the program. You'll be doing some bronchoscopy training, some mock tests with codes, kind of intubation set up as a test for scenarios. Um, yeah, they'll pretty much be asking you to kind of get your way around a ventilator and have you set it up, no problem, for your set scenario. Some of the prereqs involved, really basic anatomy and physiology, microbiology, college algebra, college English, medical terminology, kind of program dependent, not all places require it, and introduction to chem. So this is kind of a broad selection of course requirements. Something I didn't mention earlier was cardiopulmonary pharmacology. You'll be learning that in how my program did it in two parts. You'll be learning kind of um, your Saba, llamas, all that stuff, and then you'll be learning more on um, your you know disease dependent drugs for pediatric patients who has cystic fibrosis, such as your pulmazine, your Dornase alpha, those types of drugs. But some programs will have you just do one pharmacology class, and that's it. The exams, these exams I hear are changing in 2027, um, but nonetheless, kind of right now, what's required is 80% or better in your classwork um, for each term. I think that's program dependent. Some go down to like 70, but most programs they'll want you to have an 80% or a B during the whole program. So you have to get pretty good test scores. You have to do your work. You have to make sure you show up to class. It's kind of the basic requirements. TMC is the therapist multiple choice. Once you graduate, you'll be required to take a TMC test. If you pass, you'll have your CRT, which is Certified Respiratory Therapist. Most places do not hire CRTs. Once you have your CRT, you pass your TMC, you'll be taking the ClinSim. ClinSim is a clinical simulation where it's about, I had 12 scenarios, 10 or 12 scenarios. And they're kind of just like, what would you do with this set scenario? All right, next slide. You've done this, now what? Next slide. You've done this, now what? And basically, it's a kind of you're in the patient's room and you're the one treating the patient. Kind of what would you do? All right, the most important, pay. This image is a little bit blurry, but you can kind of see about 43 an hour is the national average. So pay. Once you graduate, the pay will be a lot, slightly less than a registered nurse pay. So some facilities pay their nurses about 40 an hour. You may start at 35. So there's a $5 gap. Obviously, this depends on experience. Northern California pays more than Southern California. Uh, and then travelers, generally you'll need about 1 year experience with intensive care training, and then you can become a traveler, which the pay is pretty great, 1,500 plus a week. Just kind of depends on the facility, depends on the shift. Night shift, there is usually a differential, so pays a little bit better during nights than days. Just another thing, most respiratory therapists are not salary based, so if you're looking for a salary job, this isn't the job for you. These are 12-hour shifts, 3 to 4 days a week. 7 to 7 is kind of a common shift. And if you do evenings, evenings are anywhere from like 12 to 12, I believe. All right, so is it worth it? So my experience being a respiratory therapist, it's great. It's a great job. There's a lot of information, but once you've graduated, you start working as a respiratory therapist, things are a lot smoother. Your clinical skills, your attention to detail is very important. And this can kind of make it or break it with how coworkers work with you. If you're kind of a lazy worker and you just do your treatments and you don't ask anyone for help, it can be kind of boring, right? But if you're interested in like getting into NICU, getting into flight, it's definitely a good field to get into, especially if you like airway management. I was a CNA for a little bit. Personally, I don't like wiping ass, so that was a major motivator to become a respiratory therapist. Another thing too is you're not going to be assigned to just one floor generally, unless you're in the ICU, NICU, or some of those higher acuity type floors. You're going to be probably, cardiopulmonary floor and maybe surgical floor doing nebulizers, maybe ER as well. So you'll be kind of bouncing around the hospital, which is kind of nice kind of a headache too. So if your hospital sends you all the way to the top floor while having the ER, you'll be going up and down the whole day, which can kind of be cumbersome. Personally, I don't like that. I'd rather um, have respiratory therapists kind of closer to their floors so they're not bouncing around every time a patient is crumping down. Um, Generally, we're pretty short staffed. So, what I mean by that is respiratory therapy is a high demand right now. You can look anywhere, everywhere's hiring. Um, it's about a 20-to-1 ratio. And why is that? It's probably because not many people have heard of respiratory therapists. And if they have, it's probably because they've dealt with one for some respiratory issue in the past or because they were referred to by their buddy who's a respiratory therapist in a hospital. Personally, I was a CNA. I met a friend that was a respiratory therapist, and that kind of motivated me to become one. But we are very understaffed. Um, so 20-to-1 ratio, about 6 to 7 RTs on a good day on a big hospital. So, if one person's short, that could be about 10 patients that are dispersed among the 7 of you that will be picking up the workload. So, just kind of something to think about. And your growth can halt depending on how you work. Kind of just touched on that earlier. So, if you're lazy, you're uninterested, you're not motivated, it could be very, repetitive, right? You'll be doing, okay, I'm doing my vent check, I'm doing my breathing treatments, and that's it. It can be kind of boring. So, um, make it with what you will. There's a lot of downtime on some of the slow days, but some of the busy days you can be stuck in the ER and not see the light of day. So, very, very bipolar work days. Um, and lastly, you know, being a respiratory therapist isn't just about making money. Money's nice, don't get me wrong, but you're giving people the ability to breathe, which if you guys breathe, which everybody should, right? That's important, right? So you have a really important job, and doctors and nurses rely on you. So they'll be calling your phone all day saying, "Hey, this patient isn't breathing well. I've put him on 100%. Can you come look at him?" Sure. Um, and once the patient feels better, you lowered one stress for the nurse, which is great. There are some um, rooms to grow, right? So if you get your bachelor's, you can apply for grad school. And grad school is a great option to continue on, whether you want to be a PA, a perfusionist, uh, whatever, anesthesia assistant. Respiratory therapy is a great way to get your foot in the door as like kind of a mid-level healthcare provider, sorry, healthcare practitioner, and make your way up the ladder. So those are my 2 cents. Let me know what you think. Let me know if it's for you. And yeah,